Good afternoon and welcome again to another video. This video is going to be for all of my patients suffering with chronic pain and you don't know what to do or how to discuss this with your doctor and to keep you and him or her safe. I'm going to give you 7 easy steps, 7 easy tips to keep you safe and to keep your doctor safe. Stay tuned after the intro. All right, so we're going to jump right into it. And by the end of this, I'd have given you a complete compliance plan that you can help your doctor stay in compliance and to stay safe, and that keeps you safe. Part of the job is just knowing what things you need to know and knowing what things you need to share with your doctor. So number 1, you need to take some things with you whenever you see your doctor for the first visit. These include your old medical records. It's going to be your responsibility to get a copy of them and bring them with you. Also bring in any old imaging reports. This would be the reports. You don't get the actual study, but just get the report from the radiologist or from the hospital where you have the test. The last one is if you have any studies, any operations, any old test results, I want you to get those and give them to your doctor. A current pharmacy medication report is key. You'll need something to prove the medications you've been taking and that they've been consistent. If they haven't been consistent, make sure you share that with your doctor. All of these things need to be in place. And this is something that you need to tell your doctor if he doesn't request them, if he doesn't ask for them. These are things you're going to need to have in your chart. So tell your doctor, look, make sure you have these things, scan them into my electronic medical record, and document them all. Because if your doctor is not documenting all of these things in his record before your initial visit, you and your doctor can be at risk for falling out of compliance. So in summary, make sure that you have a copy of your old medical records. Make sure that you have a copy of any imaging reports that you've had. Make sure you have a copy of your pharmacy report, any pharmacy records, any medication records that you've had. These things will need to go into your chart. They'll need to be documented, and your doctor needs to make sure that they put them in there. Almost demand, let your doctor know, hey, in order for me to be in compliance, this is going to keep you in compliance, and that's going to keep both of you safe. So make sure that he or her is putting this into every single record upon the initial visit. Do not wait. Do not try to get these records later or say we'll search for them. You need to have them with you. This will prevent delays in your treatment and keep you safe. All right, number 2, maintain a daily pain diary. This means and it doesn't have to be a formal diary, just get a notebook, but make sure every single day, put a date, put a time, and keep a diary of how you feel with and without treatment. So let's say that you've been taking any simple treatment that you've been doing for your pain. Let's say it's physical therapy. Let's say that you wake up in the morning, you feel this way before. After you've tried this certain medication or treatment, this is how I feel after. You're gonna need to have some evidence to show that you need to continue your current treatments or medications or not. We need to show this daily. It needs to be in your chart. Your doctor would do better if they have their own pain diary, but if they don't, I'm just showing you how to have some accountability and to keep your doctor accountable. These things need to be put into your chart. You need to show that you need your treatment or your medication. You need to show that it's helping you function better. And that's the number 1 key term. Your medications or treatment should help you function better. So a pain diary is going to show that when I wake up, I have this pain level, this level of function. I can barely function. I can barely do anything. But after I've tried this, after I've taken this certain medication, or after I've tried this treatment, look at the things I'm able to do. So it demonstrates that you have an increase in function and a decrease in pain intensity. And that's what needs to be written in your pain diary. Or if you're started on some new treatment, and it doesn't increase your function, if it makes you function less, if it causes a bunch of confusion, headaches, if it causes you to have problems, or over time, if you start to see that you're having a decrease in function, make sure you document these things in the pain diary. The pain diary should be copied, and it should be given to your doctor at every single visit when you go each month, and he or she should be scanning this into your record so he can have a written record, a daily record of how you're doing, not just when he or she sees you, but it needs to be in your record of how you're feeling every single day. And this is a standard. To keep your doctor in compliance, you're going to need a pain diary. All right, number 3. Do I agree with it? No, but I'm just trying to keep you safe. The compliance plan and the laws that stand right now are not particularly pro-patient or pro-doctor. What I'm trying to do is give you a compliance plan so that you and your doctor can remain safe. These are ways you're going to have to hold your doctor's feet to the fire. That means, hey, you're going to have to do these things in order to maintain me as a patient and to maintain your status as a pain management provider. Even if they're a family doctor, even if they're a neurologist, even if they're your surgeon, even if they're your OB-GYN, anyone who's treating you for a pain disorder, they need to have these things present in their chart somewhere. This is to keep them in compliance. And these things aren't plainly written, but it's part of the Controlled Substances Act, which is the act that prosecutes and creates these legal charges against physicians. This is where it's present, not in your state medical board guidelines. That won't be where you see it. You won't even see it in a lot of the different rules and regulations that you get from the CDC. These are legal matters. So your compliance plan is going to be something from a legal standpoint, and this is what you're charged upon. Seldom will you see problems from a state board standpoint because they usually don't even get involved until something else happens. And now the federal things are coming, the federal implications are coming before the state oftentimes. So we want to make sure that you're remaining in compliance and keeping your patients safe, keeping your doctor safe, keeping yourself safe. And this is what's going to keep you safe. So expect your new doctor, if you're going to a doctor for the first time or if you've had a doctor for that time, you need to make sure that you have the following. He needs to make sure that he's ordered and attempted physical therapy. Make sure that you've been given some home exercise training so you can do these things at home. And it needs to be documented in your chart. When, where, and how long ago. How did it help you and how did it not help you? That needs to be in your chart before you've tried a pain medication. If you have had physical therapy in the past and it did not help you, your doctor's going to have to have a copy of that physical therapy report in the chart. We're going to need something in that chart to show that you had physical therapy, that you've been treated already by a physical therapist. This is how long you did, and this is your response to it. If it did not help you or did help you, these things are going to have to be documented, and you can do them. You can even document, hey, this was my response. Write a little letter to your doctor and attach it to the physical therapy report. But make sure you have documented in your chart when, where you have this physical therapy, get some proof from where you had it. And if you don't have that proof, your doctor's going to have some physical therapy evaluation, at least in his chart, to show that this was tried before. Conservative approaches are preferred right now, and conservative approaches are expected from a compliance plan standpoint. So make sure that your doctor's sending you for physical therapy. The second thing that they need to make sure they have present is imaging studies. They're going to have a CT scan or an MRI in your chart. That means that they're going to have to order something for you, even if you've had one a couple of years ago, even if it does not show anything new. They're going to have to demonstrate before they start doing all their procedures, interventional procedures, before they start trying to give you these medications. They're going to have to reprove and get evidence of your chronic pain syndrome again. And they're going to have to document in the chart. Demand these things of your doctor. It's going to keep you safe and keep him safe, him or her safe. If you do not do this, later, all of it could stop and your doctor could be stopped from prescribing the medications for you or treating your pain, and then you'll be without a doctor again. So I'm just telling you the things as part of a compliance plan. This needs to be in your chart. Make sure that it's updated. If you're seeing a new doctor, then make sure that you are having a physical therapy consultation, that you've had, a proof you've had one and it's failed or it helped you somewhat, and have some imaging studies. You need a nerve conduction study if you've had one before. Make sure you get copies of your medical records. If you've had imaging studies like a CT scan or MRI, make sure that you tell your doctor, put these things in the chart. Make sure he's documented that he has reviewed the results, and this is your plan because of those results you've reviewed. And if you don't have a current one, which means if you don't have one within that year, or if you're a new doctor seeing that patient for the first time, get your own imaging study. Make sure that you do this because this is very important. to demonstrate proof of why you're treating that patient long term for a pain condition. Third thing, your doctor's probably going to order a new urine drug screen. If they do not order it, make sure you impress upon them that, yes, doctor, I need you to do a urine drug screen. They need a baseline urine drug test to make sure they know exactly what's in your system and to make sure and document that there are no illicit things in the bloodstream or in the system before they initiate treatment. And they need to make sure they demonstrate that the medications that they're giving you are maintained within the system. They need to make sure this is in your chart. For some states, you have different rules, but I will tell you the expectation is that for patients based on risk, low, moderate, or high risk, there are going to be different levels of treatment, which are testing, which is expected. But your doctor is going to make sure at least 4 times a year, if he's in the state of Georgia. Some other states you're going to have to test more often, some less. But make sure that your doctor is testing your urine drug, especially before they initiate medication treatment for the first time, and then thereafter they can kind of spread it out. Make sure this is in your chart. And if you need a copy, get a copy, but make sure your doctor, when he first comes in, he documents this in your record, and then every time a urine drug test is done or a confirmation, make sure that's documented in your chart. This is going to keep you safe as well as your doctor safe, which is going to keep both of you safe. This is accountability on both ends. Third thing, your doctor's probably going to want to see proof that you've been trialed at least on a non-steroidal anti-inflammatory drug. That's like any old drug like the Celebrexes or any medications like that, anti-inflammatories. They're going to have to document that you have tried and failed an anti-inflammatory medication in the past. This needs to be in the chart before they initiate any sort of opioid-based medication. They're going to have this present in the chart. They're going to have to show evidence of it in the chart. That means if you have an old medical record, it needs to be in there. So expect that your doctor's going to need to place you on a trial, even if it's for a week. Make sure that they start you on a trial of anti-inflammatories, because this is standard of treatment. This is what's expected, that you are trialed on conservative measures first before you're put on an opioid. And it's not enough to say that, hey, I took the patient's word for it, or the patient told me this is what they're on. These days, that is not a compliance standard. These things may be medical standards, but it's not a legal standard. In a law standard, in a legal standard, they're going to say, no, we want you to have proof. Medical, it's different because we're trained to be compassionate. We're trained to believe what the patient is telling us. From a legal standpoint, that is different. So I need patients to understand this. You want to have a compliance plan that is legally acceptable and will help you, not one that is just based in whatever the patient's saying. That's from a medical standpoint. We're talking legal now, okay? So make sure you have a trial on anti-inflammatory medications. And lastly, your doctor's probably going to need to do or attempt, or at least refer you out for interventional pain procedures. This is another conservative step. Even though called interventional, they're going to expect your doctor not to just be throwing a bunch of medications to you. You're going to have to see if there's some surgical intervention that may help your pain. Is there some psychological, behavioral modification therapies that may help your pain? Of course, we already mentioned physical therapy. They also may need to check and see if any sort of intervention may help you, or surgery. These are things that are normal and necessary from a legal standpoint, not always medical, because we know everyone doesn't respond to a certain medication. Everyone didn't respond to epidural treatments or facet blocks. Everyone didn't respond to certain things. However, from a legal standpoint, they're going to need to see that these things were tried and failed. And if you do not try these things, and if you haven't shown that you failed on them, then this is going to be not in compliance, and you could be subject to further disciplinary action. So I want to make sure you understand this. The legal standpoint from a compliance plan in 2020 is that you show that you have taken or have tried and had some sort of adverse effect to or ineffectiveness to an anti-inflammatory medication. Also, try any other conservative means. That means physical therapy. That means getting a surgical consult of some sort, or undergoing an interventional pain procedure. Then you move on, if you need to some of the other treatments that you can use for pain, including opioids, okay? All right, number 4, take the medications as prescribed by your doctor. I know a lot of you are used to taking the medications and you know just how to take them. You know how they work best for you. However, I am just imploring you, please make sure if your doctor states to take this medication up to 3 times per day or take this other medication every 12 hours, make sure you're doing this and documenting it in your pain diary. Do not, I repeat, do not undertake or do not overtake your medications. Take them just how you're, because this is going to keep you safe. This is going to keep you from having adverse effects or even serious effects that could result in death. I want to make sure this keeps you safe because your doctor is being held accountable for your outcomes, even away from his office. So if you have a serious side effect, including respiratory depression, hospitalization, or even a complication as horrible as death, your doctor could undergo further disciplinary actions just based on what happened with you. So I want to make sure you're taking the medications only as prescribed because the doctor will know how to tell you that if you take them this way, you will remain safe. However, we've seen legal implications for doctors where patients have gone off, overtaken or taken more medications because they're having more pain or they just were feeling sad and depressed. They took more and more tablets, or they took the whole bottle or half the bottle. They ended up dying, unfortunately. And guess what? The doctor eventually was charged with a murder and sent off to prison. Some of these doctors are in prison now for 25 plus years because of this. I want to keep you safe. I want to keep your doctor safe. I want to keep you both in compliance. So make sure you are being safe with your medications. Take them only as directed. Document when you take your medications in your pain diary. Share these every visit with your doctor. Make sure you're giving him a copy of the pain diary to scan and put into your medical record. And then once you've done this with this pain diary, keep it every day. And I know it may get on your nerves, but make sure you document it, please, from a legal standpoint. After you've done this, you need to contact the doctor immediately if you have any side effects. That is itching, if you have any scratching or itchiness around your throat, if you have any swelling or puffiness around your nose or lips, or if you feel your throat's tightening, if you have any flushing of the skin or face after you take a medication, if you have any issues like it feels like it's just putting you to sleep all day or decreasing your function, let your doctor know immediately and document this. Make sure your doctor's documenting this and make sure that he does something to treat this problem. He should not just be saying, oh, stick with it. Because if you're having a serious adverse event, from a legal standpoint, the standard is for him to do something about it. They should not just ignore it. They should not just say, stick with it. Oh, it's okay, because this could be an allergic reaction, a hypersensitivity reaction, or it could be a serious adverse side effect, which means something needs to be done about it. They're going to have to do an intervention, which means they may have to stop that medication and start you on something else immediately, or send you to the emergency room for treatment. They may tell you, hey, take some Benadryl and go straight to an ER. So I'm just talking from a standpoint to keep you safe and keep your doctor safe. Make sure you take those medications as directed by your doctor, nothing more, nothing less. If you find you can't do this, let your doctor know exactly what you're thinking and doing. And you may need to make sure these are all documented in your pain diary. That's what I'm saying. Get you a little composition book. I have a lot of them here. I bought them for cheap online, and keep them and fill them up from day to day when you see your doctor. Let them know about your function. Let them know about the medication when you're taking it. This is very important from a legal standpoint. All right, number 5, when it comes to getting your medications filled, make sure you stick with a singular pharmacy. What I found, especially since I grew up in a small town, I always went to local pharmacies. We didn't have large stores you can go, like big box stores you can go to get your medications filled. So I'd go to a local pharmacy. They knew your name. They knew exactly what was wrong with you. They could tell you things about your medications. They could talk to you and teach you more about them from a pharmacological standpoint. But most importantly, you developed a relationship with them so they weren't distrustful of you. This is the age of distrust. This is the age where people are anti-patient. This is the age where people are anti-medication. This is the age where people are pro-litigation. And we want to make sure that we are keeping you safe. I'm not pro anything else but patient. I am for patients. I'm for chronic pain patients. I'm for acute pain patients. I'm for all patients. I just care about them getting better and being able to move better and perform better. So in order to do that, I want them to have every treatment available to them, even if that is just opioids, even if that is just interventional pain treatments, even if that is just orthopedic surgery, even if it is just a great physical therapist. I want you to have everything that you need in order for you to move forward and get out of this disorder. I've had chronic pain issues before in the past. I've had chronic migraines and things like that, and I've had excellent help. I want everyone to have access to those sorts of resources, not just certain people. So I want everything to be legally okay for you to be treated. As someone with a vested interest in your success, I want all of you to be able to get these treatments. So choose a local pharmacy. Make sure that you go to these companies and tell them exactly what's going on with you. Be honest with them and make sure you build a relationship. I choose them over the big branch chain places because a lot of those places, there's no ability to have a relationship. They have multiple people coming in and out, her pharmacists from different areas working part-time, and you'll never gain a relationship with them. So I'm just saying that local pharmacies may be a better option for you from a relationship standpoint. And that's why I choose to get medications filled if I were you. All right, this is number 6, and this might be the most important one I talk about with you. If you could watch any of these, I think number 6 may be the most important one that you watch. So stay tuned. Do not turn away now because this should have been number 1. But I guess I wanted to really just go through some basic things before I got into the meat of this topic. So number 6, do not, and I repeat, if you are approached by someone at any point in time, even if it's your sister or brother or your husband or wife, do not give them your medication. Do not share your medication with anyone. Do not purchase medication off of the street or buy it for a friend. Do not, if you're short on your light bill or your rent, do not sell part of your medication or whole of your medication to anyone. Do not divert your medications by crushing them up and using them in any way other than the way they were described for usage. That means do not crush your medications. Do not boil the medications and inject them. Do not split the medications in half. Do not do anything that you weren't asked to do so by your doctor. This is going to keep you safe. This is going to keep him safe, and this will keep the public safe. Do not divert prescription medications. This is the number one way that you will have problems. You will lose yourself. You'll lose your freedom. You'll lose your doctor. More than likely, your doctor will lose their freedom and their business, and you will lose your pain management provider. And there are only a few of us in the country. There are not many at all who are going straight into fellowships and spending an extra year after all the training to treat people who suffer from chronic pain syndromes. So I want to make sure you're staying safe. So make sure that you stay alive. Do not buy things off the street. Do not share your medications. Do not share them for free. Do not purchase medications. If you're approached by someone to go to see a doctor, to see a legitimate doctor for a pain syndrome when you don't have one, just say no. Do not see them. I would almost pay you not to go and see a doctor. Do not go and see a doctor. Do not go to see a doctor to feed an addiction or to get $500 or $100 from this person if you go and fake symptoms. Do not. Too many doctors are falling prey to this sort of activity. Those are called sponsors, and those are people that will give you medications or give you part of the medications back or give you money in order for you to go to a doctor and fake symptoms. They may approach you. They may have approached a friend of yours, and they may make it pretty lucrative. Hey, if you go do this, go do A, B, or C, I'll give you $250, I'll give you $500, or I'll go give you this certain number of pills. I'll give you this much money. Please do not do this. This is not going to work out. It's not going to work out for your doctor. Eventually, and I do mean sooner or later, but always you're going to get caught. This person's going to be undercover. They're going to be captured by an undercover. Your name will come up. They'll come and threaten you. You'll have to testify against your doctor at trial. You probably will and always will get prison time of some sort, and your doctor will too. Your doctor will lose the practice, and you both won't have a chronic pain provider at all. And they're becoming less and less. So family doctors now aren't able to prescribe long-term for chronic pain disorders, and the few people you have available as chronic pain practitioners won't be able to either. So the field is subsequently dying because of diversion and other things. But diversion is something we can control. We can only control what we can control, and we can control this one. So number 6 is a big time no, it's the most important one. When and if, but more than likely when you're approached to misuse your medications. If someone catches you outside as you're walking to your car, if someone outside says, hey, we know that you have a pain disorder. I hear that you have medication. How about I give you $100 if you give me some of those medications? This happens to a lot of people, but this is the point where we can stop it. We can turn the tide. Do not say anything but no to this person. Make sure that you're staying safe and doing your part to make sure you keep your doctor and yourself safe. This is part of the compliance plan for 2020. This is where we say no to spreading this problem. This is where we cause this epidemic from our standpoint, the things we can control, where we keep our chronic pain patients with a good name, with a good reputation. And these are the things I know you can do. So make sure that diversion is not something that we're doing. I'm going to spend the time on this that I need to make sure I get this point across. Make sure that these people who may be sponsoring patients are called out. Make sure your doctor knows who they are. Make sure that you let your doctor know, hey, this is going on. They're putting me at risk and you at risk. And they definitely are. Make sure that you get these people out of the place where you're getting your legitimate pain management care. Make sure that you don't mix in with them at all, and make sure your doctors, nurses know about it. Don't stop the buck at the receptionist. I'm going to tell you why. The receptionist is busy, and they probably aren't going to tell the doctor anyway, because the receptionist is busy and they don't know what's important to the healthcare professional. However, the patient knows about their condition, and they're the most knowledgeable person about their pain condition. The doctor should be the second most knowledgeable person about your pain condition after you're the most knowledgeable. So don't tell the receptionist, hey, there's a sponsor out there, and there are about 3 of your patients who he's offered money to, and they've taken it. You need to let the doctor know. Even in writing, make sure you let the doctor know. This has to go to the doctor. No, don't stop it here at the front desk. This goes right to the doctor's hand in a little envelope, and let them know so they can document it. These people are going to have to be urine drug tested. We're going to have to make sure that we do a PDMP report to make sure we know what's going on with them. Make sure that you may do a pill count on them. And don't worry, I'm going to have this same talk with the doctors in my next video. But I wanted to make sure and share something with the patients, because I want you to feel empowered to be able, when you talk to your doctor, you talk to them with knowledge. You tell them, hey, this is how we're going to maintain safety. This is how we're going to stay in compliance for 2020. And it's a team game. It is not just your doctor's role. It is time for pain patients as well as their doctors to work together. And we're going to fight back to make sure you continue to get safe treatments. And they're going to practice safe prescribing practices to keep you safe. And I think other than this, the only things to think about is that you'll be targeted by law enforcement, you'll be targeted by the DEA, and you'll be targeted by criminals. You'll be targeted by these places because they're waiting for you to do the wrong thing, because there are other people who've done the wrong thing before. So it's different if you have people who have, if they're just making this stuff up. But then when you have the random patient who has gone out, sold a pill or two, given a pill or two to a husband or wife, and the husband or wife has died, or given a pill or two to a friend and the friend has died because instead of taking the pill by mouth, they crushed it up and snorted it, or injected it IV because they had a problem you didn't know about. Then the next thing you know, they're carting that person off, you off, and your doctor all off to prison. And you're all wondering what happened or why. I don't ever want to see this again happen to anyone else. So please, 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 do not divert the medication. Take the medication only as prescribed. Do not sell it. Do not give it to anyone else. Don't take anything else. If you go to a party, you have a weekend where you've been drinking a lot, make sure you let your doctor know. Your doctors are human too. Make sure you let people know. Do not go using other medications or other substances. Keep yourself safe. I want to see you stay alive. And as I said before, I would rather pay you money to not go to anyone else and give them and take medications off the street, hey, and let someone else buy your medications for you. I'd rather have law enforcement or someone else pay you cash money to keep you safe. Please do not sell medications, buy medications, take your medications with other drugs. This is only going to hurt you. This is going to hurt the field of pain management. And I love this field. This is one of the best fields in the world. This is one of the best fields in the world. But I don't want to see it end. And right now I hurt because I feel like I see it ending. I feel like I see things falling in and the walls caving in on either side of us. And I just want to keep you guys safe. I want to keep your doctor safe. I want to keep it so you have a compliance plan in place that works and that makes sense. So please avoid sponsors. Don't divert medications and work only with your doctor and never share medications, even if it's with your husband or your children. Please don't do it. Okay. All right, we've gotten to the end. This is my last one for you. I told you I'd have your big one near the end, and number 6 was your big one. Number 7's something to keep you accountable. We give the doctor and his nurses a certain amount of accountability when it comes to our treatments. However, I want to empower you in how to treat yourself and how to also document these things in your pain diary. This is important because from a legal standpoint and a compliance standpoint, you're going to have to show that you're trying alternative treatments and therapies for your pain. This includes nutritional therapy, as well as any other stretching and strengthening exercises that you can be doing, along with taking medications or undergoing surgical procedures. So what I'd like all of you to do in addition to your pain diary, I want you to, underneath in the little section, write down how from a nutritional standpoint, you're doing things to decrease your pain. That means if you're trying new diets or new therapies, new treatments from a food standpoint that reduce inflammation, this needs to be written down and placed in your pain diary. Especially if you're doing walking, jogging, walks, movement, how far, if you couldn't take steps, and then all of a sudden you saw that you're taking, 500 steps a day, 1,000 steps a day, 10,000, if you have one of those little watches to keep watch of your steps. Then you say, hey, did some stretching exercises, tried progressive exercise in my gym, got a personal trainer. All these things need to go into your medical record. And a lot of times we forget them when we go to see our healthcare practitioner, and they forget to document them. Well, this is not going to be in compliance. You're going to need to make sure you have a chart that shows that you've tried all the primary preventive techniques. You've tried all the things to keep your pain out of the way. This is why you've had to resort to taking opioids. This is why you had to resort to having to get an interventional pain procedure. This is why you've had to resort to get another orthopedic surgery. You want to make sure before people are doing interventional treatments, including interventional pain medication treatments, that you tried all the conservative approaches first, and this needs to be in your chart. So make sure that from a nutritional standpoint, you document that you're on some sort of plan that involves decreasing inflammatory foods that could be making things worse for you. You also need to have in your plan somewhere where you're doing home stretching, different levels of activity you're doing in your home. You need to have all these things in your pain diary. A pain diary is a must because as it's copied, it's going to go along with the medical record to show that, one, you're keeping yourself accountable and keeping your doctor accountable. And then that means that if your doctor does happen to, he happens not to write things in the chart or miss things in the chart, this is going to keep you and him safe, because the whole plan is just to keep you both practicing, to keep you both alive, to keep you safe, to make sure you're keeping your doctor or other healthcare professionals of knowledge of what's going on with you. And you want to just make sure that it's being documented in your chart, because if it's not in that chart, it did not happen. I repeat, if it's not in the chart, no matter what you say, it did not happen. And most likely, if you don't see the consult in the chart, if you don't see the study in the chart, if you don't show that you've had these things done, it did not happen. If you have a gym membership, make sure that you show a copy of the bill that, hey, I have a gym membership. I'm trying to do stretching. I'm trying to do these exercises. Here's a copy of the bill to show this is what I'm doing. I'm doing everything from my end to decrease my pain. Now I need you to help me with that. This is how patients should hold their doctors accountable. And we'd expect that. We want you to hold us accountable. We want you to work with us. So it should never just be the doctor telling the patient, hey, do A, B, or C. This is my room. It's going to save you from your pain. You already know by now, you've been living with this sometimes 5, 10, 20 years. You've been through 3 or 4 surgeries. You've seen how they didn't work. You've been through physical therapists. You've been through all sorts of medications. You've had back braces and back wraps. I understand. I just want to make sure that's from a medical standpoint. When you tell all the things from a doctor and he says, yes, I know, I want to treat you, that's okay from a medical standpoint. However, medical does not equal legal legitimacy. I want to show you how to take the medical things we have and make them legal, because oftentimes what's happened is we're so concerned as doctors to do everything we know from a medical standpoint that we aren't taking care of what's legal. Why? Because we weren't trained to be lawyers. We're trained to be doctors, just like you weren't trained to be a doctor or a lawyer. You're a patient. You're someone who's suffering all day. So I want to show you how to stay safe, show you how to take care of your doctor, show you how to take care of yourself. Make sure a legal compliance plan is in place. So take your pad. I want you to write down these 7 steps I just gave you, and make lucky number 7. Make sure you copy down these lucky 7 steps. And I want you to make sure that you are writing them down and keeping your doctor on his or her toes. Make sure that they're documenting appropriately, and make sure if they aren't documenting it, you have a second copy of yourself. You wrote in your book that, hey, this increased my function this much. My urinalysis, my UDA, my UDS, my urine drug screen this day was normal and negative. My doctor showed a copy of the report for me. It was in my chart. These things need to be present. And doctors by now need to know the importance of documentation. So I think I've said enough. I don't want to make this video too long. My next one will be for my doctors. I'll make sure that we are discussing compliance plans. But first and foremost, I just want to thank you all for watching all my videos, and thank you very much for your support. In the meantime, make sure you follow me on Twitter, Instagram, and YouTube. Make sure you continue to watch my videos and subscribe. Hit the subscribe button below, that little red thingy, and also hit the bell so you can be notified as soon as I have a new video. As always, take care of yourself, take care of others, and I'll see you next time.